This conference will now be recorded.
Right, so these are about understanding about the healthcare plans do we have and all that, and followed by this claim processing and dedication, and different procedure codes, diagnosis codes, and all that. And we talk about HIPAA, like the kind of law which protects the customer's information, followed by the EDA transactions and all that. Right? These are the major responsibilities which as a BA do and all that. Apart from that, so whatever the kind of applications uses by uh, in healthcare sector, especially in healthcare sector, we usually when we talk about insurance, right? So when we talk about this insurance sector, there are few applications uses, right? So two few applications will be used in real time. So one is about facets, EMC square, and Epic. So these are the kind of softwares or ERP applications. Like Facets is an ERP application. These kind of softwares will be used for claim processing. Okay, claim processing and adjudication. All this application will be used, especially with respect to healthcare is especially with respect to healthcare is concerned. Whereas there are other applications. I'm talking about insurance sector. Okay, Duck Creek and Guideware. Okay, so these are the two applications will be used in PNC insurance. PNC insurance. This is what PNC insurance is all about. PNC insurance stands for property and casualty insurance. So here, these are the applications we use. So as a BA, whatever the kind of applications people are using in real time, so these need some enhancement from time to time, right? So different enhancements do we need to do. So these enhancements we have to
And
do.
which one, Raj? Duck
Sorry?
Creek and Guidewire applications will be used in P&C insurance. That is
Yeah,
property
property and casualty
casual.
insurance.
Okay.
Casualty, property and casualty insurance.
Okay.
Okay, so because insurance have different domains, right? So we have vehicle insurance, general insurance, property and casualty insurance, health insurance. So we have different insurances.
Okay.
So for healthcare and all that, generally the FACEIT, CMC Square, Epic, these are not only for healthcare claim processing and all, but to manage health information relating to the patient's dashboard, right? To prepare some analytic reports and all that, Epic will be used. Facets is an ERP application uses majorly for claim processing and claim adjudication. And even for PNC insurance and all that, so we use Duck Creek and Guideware applications, right? So these sort of applications, what are we talking about? Need some updation from time to time. Time to time, updations is required, right? So new other features and functionalities need to be added based on the changes in the business operations happens in that respective enterprise. So as a BA, we have to understand those, preparing some documents, necessary documents uh, relating to the requirements and all that. And we need to make sure technical people will use this accordingly. This is what generally another role which BA plays apart from the responsibilities what we have mentioned in earlier time, right? So these are the major responsibilities which BA is. So now we were talking about what exactly in health insurance is about. Before that, we were talking about healthcare sector, especially in US. I am starting from the basics onwards, right? So you have any queries and all so that you can rectify here. Just base. Yeah. Right. So this is about the basics of health insurance. Are we talking about? This is about the basics of health insurance in US, as I told you, because as you know, especially any country across the world usually spend some good amount of money in terms of providing better health services for their citizens, usually irrespective of the country. And in comparing to other countries and all, US is one of the country which spend a good amount of money in terms of providing better health for their citizens, especially who are there in across 50 states. Whoever is residing, providing better health insurances and better health services and all for the citizens and all is their prime motto. So for that, every time whenever the budget has been released, major parts, especially major parts, will be spent on two things. One is about security, and second is health. One is about national security, like military defense and all that. So usually any country usually spends on two things. One is on national security and second is on health. Those are the two major, apart from remaining things, those are the two major will be on the top side. Okay, top end. So when we talk about the basic about health insurance, especially in UNs and all that, there are some amendments happened during the implementation of the health insurance plans and all that. There were some major amendments happened, which I'll explain you in next time. So before that, I'm talking about the responsibilities of a BA with respect to health insurance is concerned. What I've explained on the Word document, that is what resemble to that. The same thing which I'm showing as a slide. So one is about identification of objects and followed by collecting of requirements and preparing some BRDs according to the requirements. And we need to prepare some functional and non-functional requirements as well, because we have two variants. One is functional and second is non-functional. Functional relating to the kind of implementation what we do, whereas non-functional relating to the performance, load balancing, fault tolerancing, how the application performance should be, the kind of results it exposes, right? So all these comes under non-functional requirements. Followed by functional and non-functional requirements, there is another aspect which we call it as stakeholder analysis, which I think the stakeholder analysis and identification and all, I think I've dealt with already, right? So followed by this gathering of requirement. These are the common points, right? So these are the common points for any business analyst provides. The last 2 points were major. So one is about knowledge of health insurance plans. What are the insurance plans do we have and all that, and what kind of services are they provides and all that. Followed by this, the kind of claim adjudication and claim management system, which BA uses and all that. So these are the two major things which, as a business analyst, you must be good at. Means what are the different health insurance plans and all that. Because you have usually you have two kind of insurance. One is about government sector, like Medicare, Medicaid, and all, and the other is about private insurances. So two kind of insurance plans do we have in real time. So those how it functions and all, what changes were happening in time to time. These things as a business analyst you must be aware of. Not only that, should know about the claim management system, how the claim process happens, claim adjudication, right, claim management. All these things are also part of the responsibilities of a BA. Understood? Clear?
Yes.
Yeah.
Right. Right. Bhavna, Nishant. Okay. So
Yes.
these are the responsibilities of a BA itself. Okay. So next, these are the major legislations or the major legislations has taken place in health insurance, healthcare. So one is about social security amendments happened in the year of 1965. The major ones I am mentioning here, not everything. Okay. The major legislations only mentioning here. So one is about social security amendment. Second is about social security amendments happens twice. One is on 65 and 72 respectively. And after that, there is an act which comes under HMO, which is something like Health Maintenance Organization, which is something similar like Health Department or Health Ministry. What we are in general terms we call it as Health Ministry and all that. This is a similar way Health Maintenance Organization Act, which was introduced in the year of 1973. And the major act has been introduced in the year of 1996, which is about HIPAA, Health Insurance Portability and Accountability Act. HIPAA we call it as HIPAA. right? This is an act which protects the health information of any of the individual, whoever is the individuals and all, in order to protect their what we call protect their health information and all that. This HIPAA Acts comes into an existence because earlier, whatever the kind of claims do we need to do with against to the insurance claims and all that used to have in paper claims. No digital format, no encrypted formats and all. Everything is paper claims. So because of these paper claims and all, which is not practically possible for us to see all that, right? So whatever the paper claims do we have and all everything to manage and monitor these paper claims and all uh, is a difficult task. First thing, because we used to send through an emails to the people so that those people will process and all that. This is one thing, one challenge which takes time. First challenge, and second challenge is about maintaining this paper claims and all may leads to the information whatever we have, the information relating to the health insurance and all, what are the information we have and all may go out. This could be the one more problem, especially with respect to paper claims is concerned. That's the reason HIPAA comes into existence, wherein whatever the transactions are we making within health insurance company between the healthcare providers and health insurance company should be an encrypted format. This is what we call it as EDA. It stands for EDA transactions, right? This is where EDA comes in, right? So electronic data interchanges, right? To these EDA transactions and all, whatever there are some different codes we have, procedure codes and all that are there. So ICD codes and all that. So those procedure codes, using these codes means for each and every transaction there will be a code number which will be used for that code. For example, 837, 835, right? 271. These are the different code numbers will be used to process the transaction. Okay. So through that, if you're doing this transaction, this will be comes under this code number. This is how this will be taken into an account. Right? This is what generally this HIPAA Act is all about. This is one thing, one major act I'm talking about. And second is about one more act which is also called as an Obamacare Act, which is introduced in the year of amended. Amendments happened in the year of 2010. There were, of course, many amendments happened in the Obamacare. Latter has been reviewed. Nowadays, it has been reviewed as well. A few points have been reviewed, and they've identified some kind of these things and all. So, of course, that's not a thing. So, major as far as the Obamacare Act or the kind of amendments happened, there were many. So, out of that, few amendments are one is about the seasonal diseases. What are the seasonal diseases people
Cold,
has
flu,
affected?
like that.
Flus and all that, right? Flu and all that, right? Seasonal diseases. This is earlier seasonal diseases will not be covered under the health insurance in earlier days. Whereas whenever the Obamacare comes into existence, the seasonal diseases is also part of health insurance. This is one thing. Second, a person who is being affected with some kind of disease and all, usually insurance companies will not be provide any insurance to them. Usually, if they are diagnosed that if the person has this problem, usually insurance companies are not allowed to provide. But when it comes to Obamacare, there is an amendment happened for the age group before 14, before 14, 15 years below than that. Whoever has got affected because of some disease, and these people are these children, especially these children were applying for insurance and all. Insurance companies should not reject their insurance policy because of this reason. This is what the amendment happened, because these are the amendments. What I'm saying is are the major ones, right? So there are many other ones. The major ones are we talking about. These are the two amendments happened, especially with respect to Obamacare is concerned, which is introduced in the year of 2010, right? So these are the major healthcare legislations happens in health insurance. Are you clear, Bhavana, Nishant?
Yes.
Clear?
Hello?
Yes.
Yes.
Right. Okay. So these are the introductory part of the health insurance I'm talking about. The claim life cycle and I'll explain. Of course, I'll explain you how this is how the healthcare system works. Because usually any doctor, any patient, because based on the insurance plan do they have, either it could be Medicare or Mediclaim plans and all that. So whenever he has visited the hospital, any patient has visited the hospital and all, uh, prior information or prior investigation needs to be done, right? So whether is they having a valid insurance or not, right? What kind of insurance do you have? Because under this, in this Mediclaim, there are different plans. Some plans only covers about plan A, plan B, and C, and so on. But that will be explained in next coming time. Just for information sake, I am explaining that, right? Because there were different sections under this plan A, plan B, and all that, plan C and D, and all that, wherein few things will be covered only in the nursing services and as well as hospitality services. In few areas, this will be covered the medical insurances or the medical equipment what we are using and all. And this is how generally this is being classified based on the plan of the kind of plan what an individual has taken. Those services only will be covered. This is one thing. And second, when comes to the private insurances and all, there were two different insurances. One insurance majorly focusing on uh, the kind of doctors what we have chosen, right? So based on the premium and all, we have to choose the doctors based on the network it has belongs to, network A, B, and all that, east and west. This will be classified as east and west and all. So based on that, whoever are the paneling doctors comes under, you are allowed to visit only those people. If you have paid a high premium insurance plans and all that, you are allowed and you are allowed to meet any of the specialized doctors. Otherwise, you are not allowed to that. So based on the kind of premium what we are paying, based on the kind of services that insurance plans and all that, services will be provided to the patient. So whenever a patient has joined for any treatment, either it could be an inpatient and outpatient, because there is a classification for inpatient and outpatient. Outpatient services doesn't mean that kind of medical uh, treatment we are giving to the patient who has not joined in the hospital. Whereas inpatient services means a person joined in a hospital because of some medical emergency, which is being under the guidance or under the observation of the nursing and as well as the doctors and all that, by putting him in some regular wards and emergency wards and all. So this matters, right? Inpatient and outpatient. Inpatient may also be connecting to the kind of surgery what we do and all that. So all these things comes under the kind of services we provide for the patient. So whenever the patient has visited for any of the hospital and all that, either this patient can visit in hospital or a primary healthcare physician. Primary healthcare physicians can also claim the insurances what the treatment they have given and all, as well as hospitals can also claim. So two different things we have. Okay, so whenever they have visited the hospital, the kind of information they were sending and the kind of benefits or the insurance company once the treatment is being completed, the kind of process what we do is all comes under the claim processing. So because we used to send the claim, the patient information report and all everything to the hospital, to the insurance company through some EDA formats and all EDA transactions and all that. So whenever we have sent these informations and all, usually the time we say it is 45 days, but the claim processing and all takes 60 90 days of time. 3 months is the time will be taken for us to complete the total process. 90 days is the time will be taken for us to complete the total process. This is what generally the time will be taken, 90 days of time. Within 90 days, the total must be completed. Right? Within 90 days of time, we have to complete. Generally, the insurance company will process the transactions and all, and they pay. Accordingly, they pay to the healthcare providers or health insurance, health hospitals or primary healthcare physicians and all. 90 days of time. If anybody is asking you about what was the time will be taken for insurance claims and all, you have to say 90 days of time. Usually we call it as 45 days, but with this way, in practical, this will be extended to 90 days of time. Clear, Bhavna? Nisha?
Yeah.
Yes.
Following? So 90 days of time will be taken for a claim insurances and all that. So this is how generally a healthcare system works. Okay, but when you are comparing to US healthcare system with then other healthcare system works, especially in Asian countries or something, like if you're comparing. So better understanding, for our better understanding, because the major responsibility of health insurance and the kind of cost, because as you know, um healthcare services, what are all emergency services, are very expensive anywhere. Especially in US, it is more expensive. So not everybody can honor. Even honoring directly via cash and all through cash is very expensive, right? So which is not, it may not be affordable for most of the people. That's the reason US government has introduced and encouraged more health insurance plans and different variants to the different people. Some insurances they are providing for age group of 65 and above. Whatever the medical services or the medical treatment they have undergone and after 65 will be taken care of by the government. And second is about another insurances and the other insurance plan we have, which is being taken care of by the state governments itself. Taking care of, managed by the taking care, managed by this state governments, right? So which is under the control of CMS, Center for Medicaid and Medicaid Services and all that, under the control of that. So they managed all the state governments will manage this, especially for low income group and disabled children. So these are the two major aspects. Again, in Medicare and Medicaid, we have different variants, of course, which will be explained in next coming time. So this is where majorly, especially in US, uh, Medicare and Medicaid, those are the two kind of services we have. So those two services were being utilized especially extensively and successfully. It is being implemented in healthcare sector, especially in US. So these, but as a business analyst, there were different amendments happens based on the decisions being taken by the state or central government or the federal government we talk about. So that amendments and all everything must be knowing to any business analyst who is working on the healthcare. This is what the major thing which we need to understand. Clear, Bhavna, Nishant, right? Because
Yes.
regular amendments happens in health insurance, either it could be a Medicare or Medicaid and all that. That observations and all we must be aware of, right? So this is what generally an healthcare system works about, right? So paying the premium and all in the uh, like paying insurance claim within 90 days of time. Usually, this is how the healthcare system works in US. Clear,
Yes.
Bhavana,
Yes.
Nishant,
Yes.
right? So these are the basics of health insurance. If you have any query, you please ask me now. So then I'll go for the kind of insurances what we have and all that.
No, not as of now.
Please, Bhavna,
Nothing, Raj.
right? So Nishant, yours,
I'm good.
right? Okay. So now we were talking about the kind of health insurance plans do we have. What are the different the health insurance plans and all that. So before we are talking about the health insurance plans and all that, let us understand how an US medical system works. Okay. Generally, this is being totally being managed by CMS. This is what we call it. Just now I have mentioned you about this CMS, because whatever the claims or what are the claim processings and all everything is done by the hospitals and all that, everything those people used to connect with the CMS people only. Okay, either if it is a private insurance and all, they connect with the private insurance parties. Either it could be in Medicare and Medicaid services and all. What are the claim processings do we need to do, right? So all these healthcare providers, right? So hospitals and all that, these people has to send the claim reports and all claim information, claim request and all everything to the CMS, because CMS is a body which usually manages all the Medicare and Medicaid services, right? So this is about the body which is under the federal government authority. So this works under the Department of HHS. We call it as Health and Human Services. This is an health insurance department, which is under government, federal government authority and all. Wherein CMS is exclusive for providing services, either the kind of the claims, whatever the claims people usually uh, expects, right? So all the claims and all everything, the Medicare and Medicaid claims and all everything happens through CMS. Okay. So next is about HIPAA, as I mentioned earlier. HIPAA stands for Health Insurance Portability and Accountability Act, which this is in law usually, which protects the medical records and the health information of the people. So whenever we were adjudicating or processing the claims and all, this information should not be going outside. So this must be taken care of by someone. Um, so this is what generally the HIPAA law, it has been introduced as I've shown you in the amendments and all. The resolutions of the amendments happened, I've shown you. So HIPAA, we call it as the Health Insurance Portability and Accountability Act, which protects the health information. Earlier used to have paper claims. Now these paper claims have been converted into digital claims. Digital claims is an encrypted format through EDA transactions and all. Generally these transactions were happening now. So the code numbers we need to register yourself because there were around 5 to 6 code numbers, procedure codes and diagnostic codes. Major I'm talking about 835, 837, 271 and all that. These code numbers as a business analyst, from a business analyst perspective, I'm talking about, okay, not by the medical coding perspective, not by as a medical coder. So I'm explaining from a medical business analyst perspective, as an healthcare business analyst perspective. So this understanding you must be having, or this idea you must be having. So those procedure codes or diagnostic codes, around 4 to 5 we have major ones that you must know. So then it will be more easier for you to handle. You clear? Bhavana,
Yes.
Yes.
Nishant. Right.
Yes.
So those code numbers you have to register because when you go for interview and all that, these code numbers will be asked by them. Which code number for which purpose are you? 837 for what purpose 837 are you using? 835 for what purpose? 271 for what purpose? Right. So for that you need to answer. Right. So this is what generally that the basics is all about. Right. So this is all about generally as I've already mentioned you. This is about HIPAAs and all that. So these are the different types of insurance. Let us discuss about the private insurances first. Followed by this, I talk about Medicare and Medicaid. So one is about private insurances, which will be of two variants. One is about HMO and PPO. HMO stands for this Health Maintenance Organization, which is a basic plan. So based on this plan, whatever whoever has taken this plan and are allowed to use or to go for a primary healthcare physician, and they're allowed to go for a primary healthcare physician based on the network because in US you have a list of doctors based on the network wise, east and west kind of stuff. Okay, so there are some panel of doctors in this region. So in which region are you belongs to and all, you are near to that places who are the healthcare physicians were there and all, you can go and meet them. Okay, you can go and meet them, and you are not allowed to meet any specialist with respect to HMO as it's a basic plan. As far as the PPO is concerned, preferred provider organization, it's a vice versa. It's a premium plan, wherein based on the high premium you are paying and all, you are allowed and you are entitled to, you are allowed to use any kind of doctor services, either it could be specialist doctors and all that. So these are the two major insurances we have under health, especially in US. Okay, so one is about HMO and second is a PPO. One is HMO stands for Health Maintenance Organization, a basic plan. Second we call it as PPO, which stands for Preferred Provider Organization, which is a premium plan, which focusing more on the doctors whoever you are planning to visit and all that. Next, followed by this is about the deductibilities and all that. So deductibilities, co-payment, and COB. This is what these are the three major points we need to understand. So these I'll explain you later. Followed by this, before that I'll explain. Let me explain you about this HMO and PPO. Okay, HMO and PPO I have already explained you. Yeah, this is about the government insurances as I've talked about. So which has two different types of insurances. One is about Medicare and second is about Medicaid. So Medicare is the kind of insurance which is being governed, which is being issued for people who are citizens of US and all that. So this comes into existence when people have crossed 65, age of 65 plus. If someone 65, 65, and so on, and about to that. So these people, whatever the medical emergencies, these people needs and all, everything will be taken care of by the Medicare itself. This is what generally the Medicare policy is all about. When we talk about Medicaid and all that, this is being organized and as well as managed by the state governments, uh, which is targeting towards the low income individuals and as well as for the disabled children. So those are the two different policies we have. One is about Medicare and second is Medicaid. So for this Medicare, the amount of money you need to pay is about 1.5% on your salary based on we need to pay in terms of percentage wise, which usually manages by FIC, which we stands for Federal Insurance Contribution Tax. Right. So these people will takes care of all the Medicare taxation and all that. So and second is about Medicare. This Medicare is usually is for targeting towards low income and disabled children, especially by the state governments. Different the all the state governments will be taking care of by that, and funding and all everything will be taken care of by the federal government with respect to Medicaid is concerned. Whereas Medicare is concerned, everything is directly connecting to the federal government. Federal government used to takes care of that. But both Medicare and Medicaid comes under CMS because both the services of Medicare and Medicaid will be taken care of by the CMS, stands for Center for Medicaid and Medicaid Services. And all. Those people will take care of this. Are you clear?
Yes.
Yes.
Nandini, Bhavna, Ishan.
Yes.
Okay,
Yes.
these kind of
Yes.
two services we have. So, as a business analyst, whatever the amendments happened in recent times, and uh, how these will be implemented in real time, what challenges you have faced while you are processing these claims and all everything. So, this experience as a business analyst you must be having, and whenever you are going for an interview, and all, people will focus more on this. That's the reason if you can see some of the job profiles and all, people will ask you clearly understanding about the process of Medicare or Medicaid services is mandatory or something like that. Apart from business requirements, documents and all, because BRDs, user stories and all were different. It's a common codes are the common responsibilities. As a BA, you must render. No difference in that. The major difference you have to find here itself is this, because you must know about what are the different kinds of insurances do we have, right? So, and how these Medicare or Medicaid services will be used in real time, by whom are they using it, right? How many people have taken, how many claims we have received so far, right? What challenges we have faced while we are processing these claims and all that. So, what are the experiences you have gone through during your health insurance as a healthcare BA during the processing of claims and all? What kind of challenges and difficulties you have faced and all? These experiences you have to share. This is what the knowledge as a healthcare BA in employers will expect from you. So you have to focus more on Medicare and Medicaid, not you. I means as a part of the course, I'll focus more on Medicare and Medicaid. Rest of remaining things, because these knowledge you must be having, and at the same time, the kind of amendments happens and all everything. This is a usual practice which you need to follow. Clear, Bhavna, Nishant?
Yes. Yes.
Yes.
Right? So this is about the common errors and all. I'll explain you about that. And these are the different billings, as I told you. Right? Usually this Medicare will have four different variants and all. So one is about four variants. One is about Part A, B, and C and D. So based on the Medicare plan you have taken, either you are coming from a Plan A, right? So for example, if you have taken Plan A, Part A and all that under this. Usually it is more confined towards inpatient services. Means inpatient services means the kind of stays, night stays in the room is being allocated by the hospitals to you, to an individual, followed by the nursing facilities and all that. All these things comes under Part A. Okay, right? So this is about Part A. When we talking about Part B and all, it is majorly focusing on the kind of uh, services in hospital has provided against to the X-rays or the kind of nursing care we have taken or the kind of equipment we are purchasing, right? Medical equipment where we purchasing based on the suggestion of the doctors. All this comes under Part B. When it comes to Part C, this is all we call it as a Medicare Advantage plan. This usually offered by the combination of private HMOs and PPOs and all that. Generally, this advantage plan and all everything is being offered by HMOs and PPO, which majorly this reimbursement as well as the reimbursements and all everything, the federal reimbursement, federal government reimbursements and all everything and all that. So this is being between the private payers and all that because one is about CMS payment system because Center for Medicaid and Medicaid Services payment system, and second is about private payers. This is a combination of both those two will be combined here itself. This is what generally the Medicare Advantage plan comes under Part C. Followed by this Part D. This is about the kind of plan we have, which talks about prescription drugs and as well as the kind of improvements do we have in all that. So which will be covered under the kind of cost which is the medicine cost, drug cost, and all in the healthcare. So all this comes under this Part D. So people are allowed to have any kind of insurance, are entitled to have any kind of plans here. Either they may take Part A, Part B, and Part C and Part D. Those differences we have to find out as a business analyst based on the claim processing. Is if you are in the claim initial stages, whereas in the processing stages, on the adjudication stages, and all the kind of responsibilities what you renders is something different than this. Okay, that is different, and this is different. Understood. So when you are processing when they are initiating the claims, the kind of responsibilities as a BA you need to render is different. As far as during the processing of claims or during the adjudication process of the claims and all, the kind of responsibilities what you need to render is something different, right? So two different things you need to understand. Clear, Bhavna, Nishant?
Yes.
Yes.
Okay, so these are the four different sections. One is about Part A, B, C, and as well as D. Okay, so what are the services covers under this Medicaid? When we talk about Medicaid, this is about Medicare we talked about. What are the services covers under Medicaid and all? These are the basic information I'm giving you. No detailed explanation about Medicare and Medicaid has been given so far. This will be done when we are going in next sessions and all that. What is about Medicare, how it works, what are the different functionalities and procedures do we need to follow, right? Who are eligible candidates, what is the eligibility criteria for that, right? So when they went for any treatment and all, how they have to process that. Once the treatment is completed, what kind of process do we need to follow for Medicare in both as for the Medicaid and all? I'll explain in detail because this is the basic explanation I'm giving you about this. No detailed explanation is being given because as this is an introductory section, I'm not going to. I'm going in detail about this. Are you clear?
Yes.
Yes.
Bhavna? Nishan?
Yes,
So
Raj.
what services? Yeah, what services covers under Medicaid and all? I'll explain it tomorrow. Followed by this, I go with the remaining aspects of healthcare. Clear?
Okay.
Clear now? There is from your end?
No queries.
You have Nishant? Do you have any queries?
No, I'm good.
Huh?
No, I don't.
As of now, you don't have
Raj,
any queries. Go ahead.
you go on, Nishant.
Oh no, I didn't say anything.
Okay. As a BA, what would be our role in medical coding?
Medical coding we don't do, right? So because based the kind of plan what do we have and all that information only will be provided. Medical coding and all everything will be done by the coding people. Those people will write the code and all that.
Okay.
So
And you
what kind
also
of
told
plan, the situation of the plan and the kind of services which is being rendered, that need to be identified by the business analyst. Accordingly, medical coding will be done by the coders, not by you. Because you need to
okay.
prepare some documents and all for that. Based on the coding and all will be done by the medical coding people, not by you. You don't do any medical coding.
Okay. And you told
That
claim
again
code
that
yeah.
sorry.
You told claim code numbers are very important, and we have to know what is a number and what does it represent, right?
Yes, yes.
Uh,
The
so,
code
uh,
numbers knowing this. Yeah, tell me. Go ahead.
my question here is like, uh, what would be our role in the claim process?
So see, as far as the claim process is concerned, your role is to that how far effectively this claim processing is happening, right? What kind of challenges are they facing? Those challenges you need to identify and you need to provide those solutions to them. That is what your role majorly respect to the healthcare BA is concerned, because for this to do this claim processing and all, they use different softwares, right? Facets or EMC Square or different softwares do we have and all that. That basic idea about facets and all everything you need to have. That is required. Okay, how the claim processing and all everything happens in facets or whatever the application is this. So that process or that understanding as a BA you must have, apart from rest of the
Okay.
things.
Okay.
Not about the medical coding and all. Medical coding and all everything done by those people, not by you anymore.
Okay.
You're not going to do that. Clear, Bhavna?
Yes.
Right?
Yes.
Medical coding you don't do, but how these claims ERP applications, whatever the faces or ERP applications are working, and how it functions and all, how it functions, how the process happens in facets and all, that step procedure and all you must know. So because there might be some changes happens in near times, this need to be addressed by you. That is what major your role is on. Clear, Bhavna?
Yes.
Clear, Nishant?
Yes.
Right? So we discuss about the kind of services which is there under Medicaid and all. Then next I follow the remaining topics. Clear?
Okay.
Right? Right, Nishant? Right, Bhavna?
Okay.
Okay, right. We'll meet the same time tomorrow. Okay.
Okay. Thank you.
Okay, thank you.
See you. Bye.